In 2021, 10.7% of all births in the United States were performed by midwives, according to the 2023 National Vital Statistics reports. That's more than 390,000 babies. A midwife is a healthcare provider who is trained to be an expert in normal pregnancy. Midwives care for people during pregnancy, through birth, and into the postpartum period. Some midwives provide gynecology and primary care as well. Midwives can play a central role in a family's healthcare experience, but many people still have questions about who midwives are and what they do. Hello everyone, I'm Daniela Contreras. I'm here with Liz Potter, a certified nurse midwife at Enloe Health, to shed light on this important topic. Thank you so much, Liz, for being here today.
I'm so happy to be here talking with you.
So let's start with, can you tell me a little bit of what type of education and certification do nurse midwives have?
Sure. So we are all registered nurses who went on and then got at least a master's degree. So some people had been nurses for a long time and then went back to school. Others of us went into it through a kind of direct entry where we did our nursing education and then went straight into the master's program. There are also nurse midwives. One of my colleagues here also has a master's in public health in addition to her midwifery education. And then I've worked with midwives who went on to get a doctorate in nursing practice and so are prepared at the doctorate level as well.
Oh, wow, that's awesome.
Yeah.
Why do people seek midwifery care?
People seek midwifery care for a lot of different reasons. Sometimes because they've had babies with midwives before, sometimes because of reputation, sometimes because they're looking for a type of relationship with a provider that we really strive to give. We are trying to provide really strong clinical evidence-based care and also look at all the different aspects of where a family is coming from. Many types of families are formed in many different ways, and we really embrace that within the midwifery community. Sometimes people come to midwives because they really want to have a minimally interventive birth.
Oh, wow.
And that's fantastic. But we also see people who have a variety of hopes and preferences for their births. And really what's important to us is that people have information and education and can make informed decisions.
Wow, that's great. That's great to hear. And what is the difference between a doula and a midwife?
Oh, that's a really good question. I'm glad you asked. Because doulas are a really important part of the team, and their role has to do with providing labor support. So they'll work with families ahead of time. Often they'll help people develop a birth plan, and they'll provide one-on-one support during labor. But their role is not that of the clinical care provider. So the midwives, the nurse midwives, especially at Enloe, are responsible for helping people make clinical decisions, for physically catching the baby, for making sure that people stay healthy and safe immediately after the delivery. While we like to also provide labor support when we can, we may be taking care of more than one person at a time. And so a doula is a support person who will be there with one family steadily throughout the process. We may have clinical responsibilities for more than one family at a time.
Oh, wow. Okay, that makes sense. How would a person request the services or the care from a midwife?
Another great question. So right now what we're doing in our practice at Enloe is that we are caring for the folks who we take care of for prenatal care. So when you call to seek prenatal care, if you ask to have an appointment with a midwife, then that's how to come in for our services. Generally, we take care of folks who are pretty healthy at baseline and have low-risk pregnancies. So there are some situations where we would either consult, collaborate, or in some cases refer to the physician or physician colleagues for provision of prenatal care and then for delivery.
Oh, great. So speaking of which, what type of care does midwives provide?
So we do prenatal care throughout the pregnancy. Outside of pregnancy, we also see people for general reproductive care, for birth control, for well woman exams, cervical cancer screening. There's sort of a limited amount of primary care type things. But mostly we focus on prenatal care and then care during labor and delivery. So we're there to help someone at the time of hospital admission. We're there throughout the labor, and then we're there to physically catch the baby and keep everything safe postpartum. One of the other things that's really important to me about having nurse midwives here and having nurse midwives at Enloe is making sure that we have a strong group of providers caring for people during pregnancy, especially because there are so many rural communities. And across the United States, rural communities are losing access to delivery facilities and hospitals. And so it is really great that we have this resource here at Enloe and that we can all work together to make sure that people from all walks of life have access to really good obstetric care when they need it.
That's awesome. So Liz, if someone doesn't have experience with gynecologists or like health visits, how would you describe the difference between seeking care from a midwife than going to a traditional gynecologist, I guess?
So it really depends, because a lot of our physician and gynecologist colleagues are also going to provide very patient-focused, excellent care, right? So I think one of the things that's most satisfying as a provider is to help walk somebody through, like if they're having their first pelvic exam, how do we do that in a way that makes people feel safe and empowered and know that they're still in control in that whole process. There are many gynecologists who will do that too. I think some of it has to do with scope. Again, we're going to be providing care for basic healthy normal, some assessment of things that deviate from that are outside of the scope of healthy normal. But then if there are things that are more complicated, we're going to refer to our physician colleagues. But we're also really used to working with people in a wide age range. And a lot of us went into this very much being drawn to healthcare and the gynecology aspects of healthcare from a trauma-informed perspective and from an empowerment perspective. So that is at the forefront of our approach.
That's great. So it sounds like it's a little more, a little extra human than
we try and really meet people where they're at, right? And really work with people every step of the way.
Oh wow, that's great. And if someone, say, needs a cesarean section or a C-section, how do midwives help in that situation?
So we're all trained as surgical first assistants. So we're not the physician providers, we're not the surgeons, and that decision to make the change to a surgical delivery is clearly made with the physician providers, but we can first assist. And so we're there on a very regular basis in the operating room as the first assistants.
Wow. And if someone wants help with pain during their labor, like, do nurse midwives provide epidurals?
We are happy to help people make decisions about whatever kind of pain management they want for labor. Our anesthesia colleagues will do the epidural placement, and sometimes people have that worry, like, oh my gosh, if I have a midwife, can I still get an epidural? I'm like, yeah, of course you can. If that's a tool that is going to be helpful for you in your birth and help keep things safe and manageable, definitely. We will give you information about potential risks and benefits of the timing of when to get an epidural, but yeah, of course. Sometimes birth gets really complicated, and the other role of a midwife is to try and keep people, when it gets complicated, to help people maintain their sense of empowerment and to talk people through it afterwards, because you can have a complicated birth or a scary birth and you can still feel okay about it in the long run if we can communicate through the process. I mean, that's what we're trained to do, right? And so we're really comfortable with many of the different ways that birth looks and sounds, because birth can be very quiet or birth can be very loud. We know how to read that because we've seen it and heard it enough that we know how to read or to hear what's normal loud and what's loud of suffering. And then how do we help redirect that? It can be loud and not suffering, and that's okay. And sometimes it's quiet suffering, and then how do we try and make that better too?
That's great to hear. That's super reassuring too.
Yeah.
And would health insurance cover the services from a midwife?
So everybody's health insurance is going to be their own
Right.
health insurance coverage, but we bill with providers. We're on insurance plans. Yeah, we're part of that system.
Perfect. That's great. And how do midwives and physicians work together and collaborate?
That is a super good question too. We work really closely with our physician colleagues, and so as I was saying before, our general practice is geared around healthy and low risk pregnancy. And we're also very good at identifying situations where things are a little bit different from that, where they're outside of just the standard healthy normal. We, in some cases, will consult, meaning we ask for the advice or opinion of one of our physician colleagues. Some cases we'll kind of co-manage, which means that we're really working even more closely together to take care of someone. And then in certain other situations, we'll transfer care, meaning that this is someone whose pregnancy needs to be followed by the physicians. But we have a great team of physicians here at Enloe. It is a lot of fun to work with them. And I think together we can really work to keep families getting care that keeps them safe and care that keeps them happy.
Wow, that's great to hear. Is there anything else that you would like to add that I didn't ask you?
I think just about nurse midwifery practice in general, one of the things that's really important to us is fostering community. And that looks like a lot of different things. It looks like recognizing the strengths of the families that we're working with. People in Butte County have been through a lot in the past 5 years, and helping people see their resilience and see how that manifests in the process of labor and delivery is really important and meaningful to us. So that means meeting people where they're at. That means understanding that people are coming to this with all sorts of different backgrounds and all sorts of different feelings about labor, about birth. And it means being part of the community in the hospital setting. So it means working with our colleagues who are nurses, working with our colleagues who are physicians, respiratory therapists. Everybody there has a role to play in helping little people come out into the world and be a new part of the community.
That's awesome. Well, thank you so much, Liz, for being here today.
Yeah, thanks for having me.
And thank you all for tuning in. If you'd like to listen to more Health Matters conversations, visit www.enloe.org/podcast. See you next time on Health Matters.